So here's a chairside hard denture reline that needs to be done. This patient came in, they had a medicated liner, and part of it's missing, so we need to retreat that and correct it. So here's what I do in my practice. The first thing I'll do is obviously remove all that material, grind out a little bit of the acrylic, and I will take a etcher and micro etch that and roughen up that surface. Once we've frosted it and increased the amount of surface area that we can bond our reline to, we'll go ahead and get that prepped. This is, in our practice, we use a hard denture reline for uppers primarily, and I find the soft is good for the lowers, but again, it's a variety of, there's a variety of reasons for doing each one of these. In this case, I'm going to show you the maxillary for the hard reline. This is a Rebase 2 from Tokuyama Dental. Tokuyama is a company in Japan, and they've manufactured these interesting products, very niche products that are chemically based, and that really seem to have a superior result. We've used it. I've been using it for many, many years now, well over a decade and a half. The material, the reason I like it is because it doesn't give off an odor and there's no burning sensation. It also cuts almost like composites. It's pretty dense material. The first thing I'll do is this is called Rebase, and it's a bonding agent, just like I said, like resin. Not exactly like composite resin, but it is an acrylic. It's a methacrylate material. But what we'll do is we'll apply this bonding agent to the denture. You use it kind of sparingly. You just put one brush over it, and that's it. You're done. You let it dry, which takes only a very short amount of time. Now, this is the most important thing. No matter what material you're using, I prefer to place a lubricant over the teeth. You can use vitamin E oil, but that kind of drips. I prefer something that has a little more body to it. So we just use petroleum jelly, Vaseline, and we coat the teeth with it and go almost all the way up to where the reline is going to be done, but not that far up. I'd like some of the material to extend over the flange. Also, I will coat the inside of the denture, or the inside, not the inside, but the outside of the denture as far as the lingual goes and the palate. Everything gets coated. That's not going to have adhesion, or not going to have a denture reline, not going to have the material bonded to it. If you don't do this step, you're in for a very long afternoon or morning, because the material will stick to everything, as all acrylics will, and it's hard to get off even without having put the bonding agent on it. It's a very good material. So when we mix it up, it's a powder liquid. We mix it up just like any acrylic. I use these big blue rubber dapping dishes, and you want the material to get kind of thick. You don't want it runny and thin, but you want it to actually almost hang on the mixer, on the mixing instrument that you're using. This is a plastic one, disposable. And then we just basically spoon this right into the denture, and we apply it and seat it in the mouth.